Hello, welcome to our presentation in the medical surgical critical care field. Our team members are Amanda Fuller, Cassie McBee, Haley Marion, myself, Michelle Manley, Nicole Lara, and Rihanna Larios. All people contributed significantly to the work of this poster. We all worked on the entire poster together as a team over Zoom. The title of our poster is The Importance of Sepsis Protocol Education and Continuing Education for Nurses Caring for Preseptic and Septic Patients. Today, we'd like to introduce to you a presentation on synthesis of research regarding nurse education and recognition of sepsis and how this education applies to patient outcomes. Initially, we wanted to choose a topic that had a widespread implications within our field. Sepsis is a life-threatening emergent response of the body to infection. It is detrimental to organs and is one of the leading causes of death in the United States. Additionally, sepsis affects around 19.4 million worldwide every year. Currently, there is an extensive amount of research that has been performed to help with sepsis bundles and protocols. Furthermore, the International Surviving Sepsis Campaign, the ISSC, published its guidelines for sepsis bundle protocols in 2004 to be used internationally by nurses and providers alike. This led us to the question, why is sepsis still affecting so many people, and why is the mortality rate still so high if all of this information is already being published and researched? After all these considerations, we decided to perform a synthesis on the nursing research of the initial education and continuing education for recognition and implementation of the sepsis protocols early, as opposed to treating by symptom with no standardization as seen with the SIRS, in order to see if there was any evidence that this would decrease the morbidity of patients with sepsis. When conducting this research to support our PICO statement, we used the Baylor Library's website and selected the Academic Search Complete option. In this option, we were able to choose other databases to help complete a more advanced search. To help filter this full large-scale search, we made sure that it was the full text and not just a portion. We made sure the published date was within the last 5 years, which would be between 2018 and 2023. We made sure that all of the articles were peer-reviewed and in English. So the databases we used to search for this were the Academic Search Complete, Medline, CINAHL, and PubMed. So the keywords we mainly used in the Academic Search Complete, we used PDF full text. In CINAHL, we used English text, any author, is nurse, and PDF full text. We also decided to look into the references of the initial articles to see if they would be a good resource of finding some background information for our research topic, which we did end up finding some references that were within our 5-year period that helped provide some background information on the topic. When going through all of our research for our synthesis of finding, we found that there were many common themes among the articles. Firstly, we noticed that nurses lacked the basic sepsis knowledge, whether that be from them getting it originally and forgetting it or not receiving the knowledge at all. They didn't have the knowledge needed to implement the protocols or detect it early. We also found that there is no standard sepsis screening tool. This is important because if there's no standard screening tool, if a patient is transferred from nurse to nurse, screening for sepsis will look differently for both nurses and they may miss something. A third common thing showed that future sepsis education should occur on an ongoing basis and in multiple modalities. This is important because if the nurses aren't reminded of the different updated findings or just the basic information of how to catch sepsis, they may miss it and overlook a sign for it. This also is important to have in multiple modalities as each person learns differently. If it is shown in different ways, it's able to reach every nurse to be able to be implemented. The most consistent finding that we found was nurses lacking the basic knowledge to identify sepsis and the expertise in implementing care once is detected, which goes back along with the nurses lacked basic sepsis knowledge. But it was very staggering to find that it was the most consistent finding, as it's so important for the nurses to be able to identify and be able to treat sepsis. Furthermore, the research revealed that nurses do not understand the sepsis bundle. This is important because if they don't understand the bundle, they don't understand how to treat sepsis or when to implement the care. So, moving on into our discussion, the research findings led us to propose a number of possible solutions to our initial PICO statement. We felt that the lack of knowledge regarding sepsis protocols to treat patients versus treating patients by symptoms with no standardization guidelines could be solved by implementing training, initial education, and continuing education. Some of the research pointed to using training programs and simulations as a way to increase knowledge when testing both in pre-training and post-training. So first looking at why should this education even be continued? So usually nurses with continued education are able to gain and retain sepsis knowledge to be used in practice. If they are continuously taught, they're able to implement what they are taught into their practice because they feel confident on that information and they don't have to second guess themselves. It's second nature. If sepsis is caught early, the protocols can be implemented to decrease mortality rates. With that confidence of being able to implement the protocols and be able to identify sepsis early, the mortality rates are going to decrease as patients are not going into septic shock as often, and sepsis is not spreading throughout the body as often. Some suggestions to help with the deficient knowledge of sepsis are making sepsis education required upon hiring and continuing education throughout the service. It is also important to watch how the education is being implemented, because if the teachings start to regress after 90 days, more education is needed than what was already scheduled. If the implementation is starting to fall and fail after 90 days, it's very important that the nurses are reminded of what is needed so that way we don't have more patients developing more outcomes from sepsis. It's also very important to enhance documentation to make handoff more clear. If there's not a standard documentation between nurse to nurse, there's going to be something that is missed when they're giving their handoff report. If there's a sheet that has sepsis clear handoff information, nurses are able to pick up where the other left off and continuing the care without having any gaps. It's also very important to implement a universal screening tool to help cases in which a patient is transferred to another hospital or even a nurse is transferring between hospitals. This is important because if a patient is transferred to another hospital, when a nurse is giving a report, they're able to state the clear sepsis protocols that's understood by both, and not each there's a less chance of something being missed. If a nurse is transferring from hospital to hospital, they are able to not have to relearn the sepsis protocols from a different hospital, but they're able to already know the protocols. Some improvements to promote patient care in relation to the nurse's role in advancing health equity are the patient's ability to diagnose sepsis early. There was a reduction of the financial burden to be placed on the patients post-sepsis. A huge problem in health equity is the socioeconomic status. If the nurses are able to identify sepsis early, there's less financial burden as they don't have to continue treatment, and there's not more treatment as it progresses. It's more equal among people. It's also important to have a lead nurse specializing in sepsis available for consultation and encouraging appropriate sepsis treatment. This is important as if there's a lead nurse, if someone is not as confident on the sepsis information, they're able to ask someone so each patient is able to receive the same care. There's not a lack of care between different nurses that have different longevities in the field. They're able to have a person that they're able to rely on for help. So, moving on to the summary. After reviewing both quantitative and qualitative articles, we found that the evidence showed the number of nurses familiar with the sepsis guidelines in their facilities is low. Some nurses may be aware of the existing guidelines, but they will require continuing education for successful patient outcomes. As discussed earlier, some nurses are aware that there are guidelines, but if they haven't used them often, it's likely they have forgotten exactly what to do. So if there's continued education, even if they don't see sepsis often, they're able to know what to do and implement that care quickly. The nurse's role in advancing health equity starts with the advocating for all staff to be trained, educated, and competent in recognizing and treating sepsis. To make sure every patient gets the same care, every nurse needs to be educated and trained equally. They need information, they need the most up-to-date care of how to treat sepsis and recognize it. We also looked into what future research may be able to be looked into to help further this cause. We saw that examining health equity by comparing rates and nurses sepsis knowledge, sepsis education programs, or sepsis mortality rates across hospitals that serve varying racial, ethnic, and socioeconomic groups. When doing our research, there was not very much information at all to be found on health equity. So it is very important to look into this more. So we are making sure that there is health equity for everyone. We also saw that this may reveal additional ways nurses' sepsis education may play a role in advancing health equity. Since we were not able to find any information, we had to think for ourselves of what are ways nurses are able to advance health equity and make sure there's equal care, which again, we found that education and maybe a lead nurse or even a sepsis response team. Thank you so much for taking the time to listen to this very important topic. I hope you have a good night.